thorax. Thorax is covered by the muscles of the pectoral region of the upper limb. In addition, the intercostal muscles and membranes fill up the gaps between the adjacent ribs and the cartilages. These muscles are providing integrity to the thoracic wall. The right and left pair of the thoracic nerves fulfill the exact definition of the bone. The posterior intercostal vein, posterior intercostal artery, and the intercostal nerve lie from above downwards in the costal groove of the ribs. Sympathetic part of the autonomic nervous system starts from the lateral horn of thoracic 1 to thoracic 12 segments of the spinal cord, continues up to lumbar 2 segment. Now, covering of the thoracic wall. The thoracic wall is covered from outside to inside by the following structures, that is the skin, the superficial fascia, the deep fascia, and the extrinsic muscles. The extrinsic muscles covering the thorax are as follows. Muscles of the upper limb, we have the pectoralis major, the trapezius, serratus anterior, pectoralis minor, latissimus dorsi, levator scapulae, rhomboid major, rhomboid minor. Then we have the serratus posterior superior and the serratus posterior inferior. Now, the muscles of the abdomen include the rectus abdominis and the external oblique. The muscles of the back, that is the erector spinae muscle or the sacrospinalis. In addition to the muscles listed above, number of other muscles of the abdomen and of the head and neck are attached to the margins of the two apertures of the thorax. Now the thoracic wall proper. The thoracic cage forms the skeletal framework of the wall of the thorax. The gaps between the ribs are called the intercostal spaces. They are filled by the intercostal muscles and contain the intercostal nerve, vessels, and the lymphatics. There are 9 intercostal spaces anteriorly and 11 intercostal spaces posteriorly. Now, the intercostal muscles, we have the external intercostal muscle, the internal intercostal muscle. Now, each comprises an intercartilaginous in front and the interosseous part in the posterolateral part. The transverse thoracis is a muscle which is divisible into 3 parts: the subcostalis, intercostalis intima, and the sternocostalis. Now, coming firstly to the external intercostal muscle, it extends from the tubercle of the rib posteriorly to the costochondral junction anteriorly. Between the costochondral junction and the sternum, this is replaced by the external or anterior intercostal membrane. The posterior end of the muscle is continuous with the posterior fibers of the superior costotransverse ligament. Now, coming to the second muscle, which is the internal intercostal muscles, it extends from the lateral border of the sternum, here, lateral border of the sternum, to the angle of the rib, till here. Okay, you can see this is the external intercostal muscles. It is replaced anteriorly by the membrane, whereas the internal intercostal muscles, it is extending from the lateral border of the sternum to the angle of the rib. Now, beyond the angles, it becomes continuous with the internal or posterior intercostal membrane and is continuous with the anterior fiber of the superior costotransverse ligament. The subcostalis is confined to the posterior part of the lower intercostal space only. The intercostalis intima is confined to the middle two-fourth of all intercostal spaces. Okay, you can see this is the internal intercostal muscles. It is confined to the middle two-fourth of all the spaces, whereas the sternocostalis is present in relation to the anterior part of the upper intercostal spaces. Direction of fibers. In the anterior part of the intercostal space, the fibers of the external intercostal muscles runs downwards, forwards and medially. The fibers of the internal intercostal run downwards, backwards and laterally. Downward, backward and laterally. That is right angles to those of the external intercostal muscles. As you can see over here. Then we have the fibers of the transversus thoracis running in the same direction as that of the internal intercostal muscle. Nerve supply. All the intercostal muscles are supplied by the intercostal nerves of the spaces in which they lie. Now, action of the intercostal muscles. The main action of the intercostal muscle is to prevent intercostal space being withdrawn during inspiration and bulging outwards during expiration. The external intercostal interchondral portion of the internal intercostal and the levator costae may elevate the ribs during inspiration. The internal intercostals, except for the interchondral portion, and the transverse thoracis may depress the ribs or cartilages during the expiration.